The 6 stages are a way to differentiate the different syndromes in Chinese medicine. It is also a way to describe the order of disease as you go from health to death. The theory of the 6 stages was first described in a book called Shang Hamlin, and although this book is almost 2,000 years old, the ideas and herbal formulas described in this book are still frequently used in the clinic today. In the 6 stages, every level has its own symptoms and signs, so proper interrogation can help a practitioner form a diagnosis and a treatment principle. In this video, I want to go through the first 3 stages and describe the different symptoms of each stage, as well as the treatment principles. The first stage is called Greater Yang. This is the beginning stage and the only exterior one. There are 3 essential symptoms to this stage, which are aversion to cold, pain in the back of the head or neck, and a floating pulse. A good example of this stage is catching a cold, and since the disease is still in the exterior layer, the treatment principle is to release the exterior by sweating. Now, there are different acupuncture points to do this, but some of the most common ones are large intestine 4, triple burner 5, or governing vessel 14. Another way is using an herbal formula like the cinnamon twig decoction or the ephedra decoction. On to the second stage, which is called Bright Yang. Unfortunately, you didn't manage to expel the cold, so now it has become interior and transformed into heat. Symptoms can include high fever, sweating, thirst, a feeling of heat, and a red tongue with yellow coating. The treatment principle in this stage is to clear heat. Again, you can use acupuncture or Chinese herbal medicine. Examples of acupuncture points are large intestine 11, stomach 44, and governing vessel 14. A great example of an herbal formula is the white tiger decoction. The third stage is called Lesser Yang, and this is the last stage for today. At this level, the pathogenic factor moves between the Greater Yang and Bright Yang stages. Therefore, one has a fever as well as cold shivers. If the disease is leaning more toward the Greater Yang stage, there is more of an aversion to cold. If it leans toward the Bright Yang stage, one is more feverish. Other symptoms include a bitter taste, blurred vision, ear problems, and nausea, which are of course typical of the gallbladder meridian. The treatment principle at this stage is to harmonize. There is actually a very specific formula to treat this stage, called small bupleurum decoction. Acupuncture points you can use are triple burner 5, triple burner 6, and gallbladder 41.